Welcome back. Experiencing cutting-edge technology at Intermountain Health with robotic surgeries. I am joined now by Dr. Richard Mayturn, urologic surgeon and regional lead for robotics, to walk us through the process in this sponsored interview. This has been the talk of the morning. Everybody rushing in to say, oh my goodness, welcome, doctor.
Thank you. Thanks for having me.
I think this is so incredible to give our viewers at home a sneak peek into the technology that you have in today's age, 2024. What's the name of this machine?
So this is a Da Vinci robot, and it's used to do surgeries basically, from the head and neck, all the way down into the pelvis.
Talk about your own experience when you first started to now. You said that this is the fifth
generation
evolution of this machine, and what have you seen and experienced over your career?
Well, I was fortunate. I started using an intuitive Da Vinci robot when I was in residency, and we got our first one in 2004. And so I've kind of seen the evolution of all the generations, and it's changed a lot. The technology's improved, the instrumentation's improved, the ability for us to be able to get surgeries done, more efficiently has also improved over that period of time.
Are you amazed by how far technology has come?
Yeah, it's changed significantly since the first robot. The initial robot is, as you can see here, there's 4 arms. The first robot only had 3 arms, and so we were a little bit limited, but they added an extra arm, which has helped out quite a bit as far as efficiency and being able to do more.
And you say those training now are learning on this machine, so this is all that they will ever know. Let's talk about the benefits, because there are a lot.
Yes. So one of the first benefits is there's smaller incisions, because it's laparoscopic surgery, so there's less chance of having an infection. There's less pain. It requires less narcotics after surgery because of the incisions being smaller, and a lot of times patients are just able to get back and get into their normal life faster because they have less pain and less recovery time.
So a shorter hospital stay,
yep,
potentially, so then you're not accruing those hospital bills for night after night there. And what about the scarring, the recovery, the getting up and back to life?
Most patients are up walking around, a few hours after surgery. Sometimes if they're feeling well enough, we'll send them home the same day, so they don't even have to stay in the hospital overnight. But most patients, at least in urology, go home within 24 hours or less after major surgeries that are done robotically. How
many surgeries? The Da Vinci is responsible for how many? Like every day, every week?
So at Intermountain, since we got our first robot and now we're up to 43, we've done over 65,000, and we're getting closer to 70,000 because we do about 500 plus every month currently.
Talk through how it works. We'll demo it in a little bit, but give us kind of an overview, an idea of how this happens.
Okay. So these are the robotic arms, and this is where all the work is happening, and there's different instruments that we put in here. Here's the camera that we use to see everything, and then there's 3 working arms. Here is the patient cart. Behind you is what we call that. There's also a vision tower where the other people in the room can see what's happening in the surgery, and then over here behind me is the surgeon console, and that's where the surgeon sits down and makes the robot move around and do the surgery.
And let's pull out an arm and just get a close-up of just how small and how precise this is. So that's what's in there. That's what's right in there, which we're going to see up close in just a little bit. You also mentioned with that quick recovery, less narcotics. So maybe they're going home and taking a Tylenol rather than that narcotic. So many benefits there. Some people can't handle it. Maybe we're not worrying about giving too much or having any addiction issues. I mean, I see so many reasons why this is so beneficial. What do patients say?
Patients are really pleasantly surprised. Most patients come back to clinic after surgeries and they say, hey, doctor, I used one narcotic pill, or hey, I didn't even take the narcotics, and I'm really surprised at how well I've done after surgery. But it's what we expect to have happen, but a lot of times the patients are really concerned they're going to have a lot of pain, have a rough ride after surgery, and they're really pleasantly surprised with how well they do.
Wow, and in those almost 70,000 surgeries, what are just a few that this has done?
So one of the initial uses of the robot that really kind of drove it in the early 2000s was prostate cancer surgery. That's one that we do all the time. There's colon surgery. Colon cancer is something that we're hearing a lot more about, and that's getting a lot better with the robot. There's hysterectomies for female issues, but basically from the neck down to the pelvis, almost any surgery that's done minimally invasive can be done with the robot.
Minimally invasive, quicker recovery, less hospital stay. We back up on your feet. Okay, we're going to see how this works. You're going to let me try it.
Yeah.
And I got a little sneak peek earlier, so we can't wait to show you how this all works. All right, so our thanks to Intermountain Health for the sponsored interview, and we will be right back with the robot, more of how these machines work after this quick break.